This program is presented by University of Missouri Extension and University of Missouri Sinclair School of Nursing. The Enhanced Leadership Development Academy is sponsored by the Missouri Department of Health and Senior Services.
Probably the 30 years that I have experience in nursing, I maybe had an hour of leadership and management skills.
I've been a nurse in long-term care for over 16 years and thought I was a pretty good leader.
RNs are primarily promoted in the long-term care arena because they're good clinicians.
They've worked their way up through the program, but a lot of times haven't had the formal leadership training that is really needed when you come into a leadership role.
And we lose a lot of very talented people because they don't have the skills to be able to deal with those things that they're facing every day.
If we can retain nurses, registered nurses in long-term care, that's going to trickle down, and the retention of those worker bees at the frontline level, the unlicensed personnel, is going to be improved. That in and of itself will increase the bottom line for nursing home owners and corporations.
I didn't realize there's so much more to leading than there is, and attending the Leadership Academy opened a lot of doors and ideas.
Leadership is an evolution. It's a transformational experience, not something so concrete, because when you think it is, that's when you're going to be ineffective as a leader.
Influence is the key word, I think, in leadership, not only for me, but for the DON.
The intent of the Enhanced Leadership Development Academy for RNs and nursing home administrators is to develop RNs and administrators who are capable of leading in such a complex healthcare environment.
Today's healthcare organizations have become complex adaptive systems, and they require leaders who have what we call systems thinking skills.
We believe that the Leadership Academy fills a void here in Missouri. There's no other certificate program like it.
And there is tremendous opportunity for RNs in leadership positions.
The nurses are often what I call the lone rangers in the nursing home. There is not a colleague reference group for them. They may be the only RN in the building, or one of only a few, and they have no one to check things with the way we would say in a hospital.
Through this academy, they're paired up with different administrators and different nurses from throughout the state, and they realize that the challenges that they're facing and the difficulties that they're facing are not unique to their home.
We think we're all alone, but we're not. We're all going through the same thing, just in a different way. Just same thing, different people.
I love the face-to-face learning environment that the Academy offers.
We were able to share those things openly and freely and without fear of being judged in anything that we did.
The participants feel safe in that there's no question they can't ask.
The School of Nursing itself has a great reputation, but also the Leadership Academy has a very well-respected reputation as well.
Because of the value that we've seen from the program, we have sponsored the program, so we provide funding so that the ELDA program can continue.
If they think this is important enough to invest in leaders in the state of Missouri for long-term care, that instantly lends credibility to me.
Well, one great benefit is that it is a certificate program from the University of Missouri. I mean, it's an impressive credential.
We've seen both clinical outcomes and social outcomes that are positive from leaders who have gone through this program.
The staff that I send to that Enhanced Leadership Academy will come back with new ideas, and then we can sit down and develop those ideas here and utilize those ideas and continue to grow from the experience of those leaders at the Academy.
We are absolutely convinced that the outcomes that we have obtained would never be possible with a totally online course. This is a face-to-face Leadership Development Academy.
So it's geared to what they need. what's practical for them, what they can apply every day.
It's unique in that no one else is giving this particular type of training because no one else is really qualified to do it.
I took more notes probably in the Leadership Academy than I did in 6 years of a bachelor's program and 2 years of graduate school, because I think the information was that rich and the experiences were that meaningful.
My experience at the Leadership Academy helped me understand my weaknesses and strengths to help improve my abilities as a leader.
They created more a culture, I believe, of supporting where we come from and facilitating sharing that information.
It reaps untold benefits. Staff retention goes up, the quality of care provided in the homes increases, and we just think it's a real value to the state.
This is a benefit and this is an investment that other nursing home owners and other nursing home administrators would definitely want to look at.
The fact of the matter is there's a statistically significant difference in the leadership practices of our participants from before the ELDA Academy to after.
You have better communication amongst your staff. You have better clinical outcomes. You have better survey outcomes from our perspective. And you have happy families and happy residents, and all of that comes back to the leadership in that home. They really drive all of that.
They know that they're making a difference for that resident, the staff, and the resident's family.
They are really helping their employees to see the meaning in their work.
It helped reinforce to me why I do what I do. You know, why I'm willing to have my phone ring 24 hours a day, 7 days a week.
I want to be effective in the lives of other people every day, and they help make that better for me.